So welcome everybody. Thank you for joining us today. My name is Mark Heimson. I lead sales for Kurmi in the Americas, and I'm joined by Jeff Dillon. Jeff is one of our technical account managers. I'm based in California. I think Jeff is in Pennsylvania, and glad you're joining us today. Today is around automating unified communications and collaboration management in healthcare. So today is going to be deeply focused on the healthcare space, what we're seeing from our customers, what our customers are asking us for, where Kurmi is automating UC&C in healthcare, and some of the outcomes that we're realizing from it. So thank you again for joining us. I want to point out you are welcome and encouraged to send in questions. I think there's a questions tab for you in the bottom right. Please send us questions. We will try to get to all of them at the end. Anything we don't get to, we will answer offline. But we appreciate you making this interactive, so please ask away. And with that, let's go ahead and get started. So quickly on the agenda, we'll spend a little bit of time about who is Kurmi. I think looking at the registrant list for this webinar, some of you are familiar with Kurmi, others are less familiar. So we're going to try to, kind of toe the line between both and make sure it's informative if you know nothing or if you know a lot about Kurmi, either way. We'll specifically dive into the healthcare challenges we're seeing. We're going to talk about a couple case studies that we have seen, one from a large insurance provider, and the other one from one from an insurance carrier and the other from a provider, both very large organizations. We'll look at their challenges. We'll look at how Kurmi was deployed and what the outcomes we're seeing out of those two organizations. And then Jeff's going to walk through a demonstration and go into some very specific use cases that will tie back to those case studies. So we think it'll be informative. And again, Q&A at the end, we'll get to everything we can. Okay, so a little bit about Kurmi. We've been around for a while. Kurmi has been in this market automating what we call UC&C or unified communications. That's inclusive of contact center today, but we've been doing this for over a decade, and it's a global company. So we've got offices around the world. We have a strong presence in the US. Today's focus will be, I think, more leaning towards what we're seeing in the US with regard to healthcare. But the reality is we support customers globally. Outside of healthcare, Kurmi is being deployed by large enterprises and also managed service providers. The common theme is complexity. The common theme is oftentimes multi-vendor or just organizations that need to operate at scale and automate these workflows and these operations as much as possible. And so with that, we're going to talk a lot about multi-tenancy is critical for them, flexibility, scalability, security. These are common themes that we see out of the enterprise, and especially so for healthcare. So I'm going to keep driving on, but hopefully that's making sense. Specific to healthcare. So the reason we're doing a webinar today is a huge number of a great proportion of our customers are in the healthcare space, and we're not seeing that trend abating at all. Today we have roughly just under 500,000 healthcare users. Again, they're both on the provider space and the insurance side with clinics and other organizations. But we see a lot of organizations in this space. And so we're going to convey some of the common themes we're seeing, why they're interested in Kurmi, and what Kurmi can do for these organizations. Perfect. So talking about that, a couple of things we're seeing that they're not entirely unique to healthcare, but they are highly prevalent in healthcare. Employee turnover, particularly around the contact center side, is not uncommon. A lot of M&A activity with healthcare. We see especially in the provider space, large providers are buying other providers and going into markets that they weren't in previously. And with that, there's just a huge number of changes as organizations are adding hospitals, adding clinics, adding other types of sites, and need to bring them up extremely quickly or draw them down on occasion as well. So something that's really unique. The other thing we're seeing, and Jeff will maybe talk about this later, but there's also common area devices in hospitals. So how are organizations supporting those common area devices, whether it's how voicemail is attached to it, rollover, the phone numbers that are aligned to it, making sure those are managed along with user phone numbers and user information as well, and profiles. So again, we're going to get into some of the unique things we see in healthcare. This is some of them that makes healthcare a little bit unique in the marketplace. And we'll get more specific as we talk about specific use cases. So I think the term single pane of glass is heavily used in a lot of different technologies. We've been using it for some time, and we think about it really in two pieces. One is this is really a multi-vendor solution. So oftentimes you might have a single vendor, or you might be thinking about adding a second vendor at some time in the future. This is a single pane of glass that's going to be able to manage multiple vendors. It's also a single pane of glass for different roles in an organization. So whether it's a help desk person that is managing a particular site with very limited kind of delegation capabilities, so maybe they can provision users but cannot deprovision users, this is going to be the single platform they use to be able to manage their really kind of small purview of administrative or help desk capabilities, whereas a global admin or a global IT admin is going to be able to see everything. So again, single pane of glass, depending on your login, you may see an entirely different set of things that you're able to do in a scope of, whether it's geography or otherwise, a scope of sites or locations that you're able to support. So with that, a couple more things I'm going to share, and then I'm going to hand this off to Jeff in just a moment. But from a value proposition standpoint, operational efficiency is the number one reason that customers first come to us. They're looking for automation. They're looking to take what is oftentimes a manual process and drive it down into a couple clicks to be able to provision or deprovision users or make changes. And oftentimes it's a zero-touch provisioning. So depending on whether you're connecting it to an ITSM platform like a ServiceNow, depending on how it's connected to AD and writing and pulling that information, these workflows can get driven down into a zero-touch scenario as well. From security standpoint, really important, I guess we touched on in the enterprise and in healthcare, role-based access control. That's probably the term you were going to hear most on this webinar. Role-based access control is critical, and it's really a security capability. So being able to limit which people in the organization can do what functions is incredibly important in healthcare and frankly in most enterprises. The ability to audit exactly what has gone on, what ticketing has taken place, what that change has been. And then there's another function that has been used, that is used heavily for security, and it's just called rollback, because we haven't come up with a better name. But it's the idea that if you make an error, if somebody else makes an error, you can go in and quickly undo that error without any issue in the organization. So the ability to undo errors, audit, and kind of a complex role-based access control capabilities is really helpful. And then the last thing we'll talk about, again, really nice for healthcare, is future-proofing your UC strategy. Most organizations, whether they're on-premise today and either thinking about or not yet thinking about, but eventually will make it to the cloud, this is a platform that will allow you to not only use it in the cloud for UC applications in the cloud, but help you get there. So this is going to help with migrations. The other future-proof aspect of this is it's deeply integrated with the UC ecosystem that may surround that you may be using, whether it's compliance recording, whether it's E911, certainly SBCs, contact center we talked about, ITSM, HRIS platforms like Workday. So any of those platforms you either already have and are looking to integrate to, this is a great way to automate that, whether it's now or in the future. Okay, we've covered a lot, and Jeff, this is one of our many handoff points. I'm going to hand this to
Sure.
you to cover.
Thanks, Mark. Yeah, unified communications has gotten messy. It's that unified piece that's really become so difficult to actually be able to handle today. We're logging into multiple systems. We're trying to actually manage multiple things. It's no longer a single vendor solution. And also, you may have legacy technologies as well as new technologies, and they're all being handled in very different ways. It meant that the engineers and technicians you're actually working with are having a very difficult time actually being able to handle all of it. Multiple logins, trying to still manage DIDs off of spreadsheets. So what Kurmi can actually do is, let's say, even just provisioning user has historically taken at least 15 minutes to actually just be able to provision a single user. That makes everybody's Monday just a real bog down of actually trying to get some of these things done. So Kurmi can actually automate a lot of that. We can add a user, move them, change them, delete them with only a couple of clicks, or even fully automated as well. We'll briefly show you also as well how we can also pull up all those numbers. Now they're going to be all centrally managed. You will not necessarily be having that spreadsheet any longer. Everybody will have access to it. You'll know what is in use, what's not in use. There'll be no more, let's call the number and see if it's actually active. We'll be able to bulk perform operations as well, so that if you do need to make changes for dozens, if not hundreds, if not thousands of users at a time, we can absolutely do that, including migrating from a legacy platform to a newer platform as well. And also, security is a big deal. And Mark mentioned role-based access control. You do not necessarily want your help desk to have access to your PBX, but they may still need to be able to make changes. So in this case, Kurmi can also sit in the middle and make sure that we're also going to be able to make some of those changes for you, whether it be for knowledge workers or for shared devices. But overall, it is really how we can get in there and help the engineers and the technicians to optimize a lot of their operations, how they can actually make things a lot faster and a lot easier. You can go ahead and advance the slide, Mark. We could be here all day long talking about the many benefits of Kurmi, but we're going to really just only highlight a few of them. So as an example, right now, we're going to talk about just kind of user profile templates. And this is really going to be, and if you want to go ahead and highlight that so everybody doesn't have to just squint really hard to read what that says. This is where we're kind of, and we're going to show this in a few moments, that how we can actually take that 15-minute process of just adding a user, a knowledge worker, we'll have it done down in just a couple of seconds. Now we've actually just built all the templates in the background. It all just makes it very, very easy. Something that could be instead actually handed off to a help desk for you instead. You can go ahead and move forward again. So, but also, if you would actually like to have this connected into your ITSM, you know what I mean, ITSM, I actually mean, ServiceNow, Surewell, et cetera. We can absolutely do that. So you can set up the workflow so that if someone comes in, you don't even have to touch it. You just make sure you've got the ticket that says, yes, their number was created. Yes, we know it was already added. You didn't even have to do anything with it. You could even bypass your help desk in that case. Just verify that it was done when you're ready. You can go ahead and move forward. And there's one more feature we also want to talk about as well, which I think we've already touched on, which is also role-based access control. And we've talked about this as well. That is going to be that we want to be able to apply the right roles and responsibilities for the right team members. So if it was something as simple as allowing a help desk to change pins and passwords, fantastic. Or if you actually want to make sure that you did even have additional levels of a help desk, we can also set that up. Or if you want to have also full admin rights just for engineering, we can absolutely set that up. So it just makes, again, that really optimizing the operations of how you can actually handle all of your UC all from one screen. Go ahead and move forward, Mark.
Perfect. So we promised 2 quick case studies. The first one we're going to cover is a very large provider. So we won't mention the name. Over 2,000 locations. This is really a massive organization, and they're a conglomeration of a lot of acquisitions that have taken place over a long period of time. So we talked about that M&A activity that we've seen in the healthcare space and how it plays out and what impact it has on IT. Certainly that was an issue for them. They had these disparate locations, disparate groups with different IT teams, that all had their own idea of how it gets done and what those UC templates and builds should look like. And so, they were launching new hospitals, new clinics, and they wanted really more control from the central IT team while giving flexibility to the local or regional teams that were managing those particular locations or sites. So it's a hard balance, frankly. So you want control centrally from IT. You want to make sure that this is something that can get replicated and you can deliver with speed to the organization generally, but you want to provide flexibility to the groups as much as you can. So ultimately, they wanted a single platform. You're going to hear some themes that we've talked about. So single platform to be able to do all of that. They really wanted to standardize on a set of builds. And so what they ended up doing was, providing a number set of builds, but it was limited to some degree. I mean, it wasn't infinite the way that the UC templates could be set up for different users or for different common area devices. It was really well thought out in terms of how they did it. And then they wanted to be able to securely delegate and use role-based access control so they could allow that work to be done by others, but have it done securely. So what ended up happening is they now have a highly standardized platform to roll out and expand. So when a new clinic is going up or a new hospital is being raised or what have you, they're able to move very, very quickly. They've reduced their times, not only the time it takes for a particular user. Jeff mentioned 15 minutes. We're seeing even longer in the case of these two case studies. It's more like 30 minutes was the old standard, and now it's well under a minute. But they're able to do it all in a centralized, organized way. The other thing that's happened is they've just reduced errors. A number of errors that used to happen routinely, you can imagine, now that it's automated, now that it's more templatized, those errors are all gone. So that's one case study we wanted to provide. And Jeff, I think I'm going to hand it to you to kind of show what this looks like in the Kurmi tool.
Sure. So just real quickly, we've kind of talked about how do we actually provision a user, and we've also talked really kind of being on a single screen. So it will be one of those things. We want to make things as simple as we possibly can to make sure that we're really going to be able to have to be able to actually get a user onboarded. But we want to make sure we can actually do this cross-platform as well. So it's going to be as simple as, because we've already built all the automation in the background, that you're going to actually see this be able to move through. We're going to do something as simple as click on users. These would have already been entered into Entra ID. They're automatically discovered. We see where they're all at. You can see we actually have Cisco users, Teams users, hybrid users that are in both platforms at one time. And then, but we're also going to have one who's just been added in Entra ID, a brand new user. You can see basically they've already got everything in there. We already know their department. We already know that they are added into Microsoft. But now instead, we want to actually make sure that they can get a Cisco desk phone with a Microsoft Teams soft client as well. So in this case, we're going to go ahead and we see that we've already added in their device information complete with MAC address. We've already got their line has been assigned. But in this case, if you don't like that particular number, we can also, if you don't like that number, red ones are already in use. Green has already is available to you. This will be shared across all the logins. No more spreadsheets. So you have all these numbers also automatically be discovered out of either your call manager or out of Teams Admin Center. And it would also work for DIDs as well as technical extensions as well if you're still using extensions through Call Manager as well. But then also kind of switching back over to Teams now that we've actually got this as a soft phone. You can see the line is actually going to be the same, but we've also added in all the information for an audio codes SBC as well. So you've now just taken 3 separate systems and been able to actually add them all in. Now we can see the users actually had their number added and all the services that are actually been called out to automatically directly from all those various systems, all from Kurmi, and you've just done this very, very quickly. So next thing, I actually kind of switch gears just a little bit, and actually, because that's how you'd actually provision a knowledge worker. But one of the most common use cases we also see heavily in especially in a hospital setting, nurses stations. And so it'll actually be, you're going to have these shared devices. And even if it is also just knowledge workers, you're going to have these shared devices that actually pop up everywhere that will also need to be used as well. And this is also, it's a different process. It's a little bit more lengthy, even on if you're using your legacy systems to be able to actually do this. So instead, what we're actually going to be able to do is I'm going to show you how we actually will just create these from scratch, a little bit different because these are devices and not necessarily users, but we already have one created. We're just going to add one just very simply because, again, we've already built the templates in the background. We're going to just really quickly and actually say where it's actually going to be going. We're going to say it actually goes into one of the hospitals. We're going to just actually give it a name. I think we'll just call it Nurses Station. We already had one created, so we'll just call it Nurses Station number 2. We already know that because we're just going to automatically activate the codes. We've already got their MAC address has already been assigned. We've already got we'll have a line assigned to it for the public line that's going to be coming in, and that's all it takes. Far faster. So that's really, and now we have a second one that's already been added. It will be automatically again called out to Call Manager in this case, added that device, and make sure that you will actually have those added in there as well. I'm gonna hand this back to you, Mark.
Thanks, Jeff. Yeah, great to see. Obviously I've seen it, but it's great to see the user provisioning, the nurse station provisioning, and we joke about it that it takes longer to explain than it does to actually do that sort of work. But I think the slides are here. We go. Okay, excellent. So we're going to move into case study number 2. So the first one was on a provider case study, large provider, over 2,000 sites. This is a insurance carrier, also extremely large, top 10 insurance company in the U.S., over 60 locations, and some of the same pain points, some of the same things we saw in the other organization, but some that are different also. So they were looking to, after an employee left, they wanted to be able to manage it and offboard that user. They also wanted to be able to time it sometimes. So sometimes the user was going to be leaving, but they wanted to be able to keep their UC in place for 60 days afterward, or a period of time afterward. You could do that as well. M&A, common theme, little less so in the insurance space, but also common. The other thing that's different here is they had a significant contact center need. So they had a lot of what they call MACDs, moves, adds, changes, deletions for the UC users around contact center. Not surprising. Those employees are oftentimes brought on. Sometimes it's seasonal, but oftentimes it's short term, and they need to either quickly provision and or deprovision those users and be able to manage that process. So their goals were, in this case, they had a homegrown solution in combination with an automated provisioning solution they had in a few of the locations. So not everywhere, but in some locations. And they were looking to just automate that entire process, again, with provisioning and deprovisioning. In terms of outcomes, I'll focus on the last one, and this is kind of the punchline, and we've seen this over and over. So for this organization, their to provision and deprovision was typically a 30-minute process, is what they calculated it to be. And again, with Kurmi, this was sub 1 minute, oftentimes fully automated. So we're looking at a 95% gain in time, or reduction in time utilized to do these things, and it was delegated to the right people. So the right help desk people that needed to do it, they're able to do it. And it took a lot of that strain off the IT team, and they could focus on other things. So again, I'm going to hand this back to Jeff, and you're going to get to see a little bit of this in action with the Kurmi product. But I think good to hear sort of the outcomes that we're seeing. And this has been deployed for about 2 years with this customer.
Sure. So in this case, it is finally going to be, how do we actually look at either from an engineering view, and then also how we to be looking at this as a delegated view instead. So if initially we're going to be looking at this, we're going to see all the sites all at once. We'll actually be looking at how everything was actually fully set up. But now we actually want to see what this is going to look like if you were to actually log in as a help desk team member. So it's basically going to be very simple, but this would be if you were that full admin what you're going to be looking at first. You want to make sure you're only going to be looking at across all the locations. You may have a local IT team instead who also needs to really be able to put this in and make sure it's really going to be switched over instead. So it's going to be something as simple, but that login is only going to see these particular users in that particular location or based on that function. So you can see just everything got a lot smaller. There's only fewer users to be able to manage instead, but you're going to be looking at from location. It may also be based on specific technologies, but they would also have fewer functions as well. So in this case, also the user list wind up dropping to far fewer, but basically they still have a lot of the same access, but it's really dependent on how you would actually like to have things set up instead. So it's fully controllable. And again, there won't necessarily be touching your PBXs. So you also have that additional level of security, making sure that no one's actually be touching anything they necessarily shouldn't be. So I just want to switch gears real quickly as well and show you. So if that was actually to have a help desk help you out and do some of these tasks instead, let's actually see if it would ever be so automated. You could have HR actually provisioning your users for you instead. So this is actually be, if we actually did connect this into ServiceNow. So you can see already that we're going to have a users are actually going to be set up here. And so if you've got a user, and these are all going to be entered in via Entra ID, could also be Active Directory. We work with both, but in this case, we've got Adele, and we'll see that Adele doesn't have a phone number, but she has a department. She doesn't really have any services. We just know she happens to be a Microsoft user. But instead, we need to go in and actually assign her some roles and responsibilities. So in this case, all we need to do is update her package. Package basically meaning also her profile of what her phone number or phone system should be, which would be based on location and function. So we just search for Adele's name, we find it. Again, we already know she's in HR. We already know that she's just an Entra ID user at this point. And then we also, all we have to do is just go in. She's going to be a Teams-based user with voice. We're going to HR could actually do this as simply as possible. And actually, as the new users get onboarded, let's just check and see if it's working. Looks like it is. Now we'll switch back over and look at it on the side with, see if, we'll go back and check and see if Adele's actually been changed. Well, it looks like she's been updated, and it will take a few minutes to actually call out to Teams. It's just the nature of working with Microsoft. But now instead, now we see she has a phone number been assigned, and all of the services have also been added. Very, very simple to actually be able to take care of these things instead. So there's a lot of chances, and also you can't actually really automate this and make it even for non-technical users as well. Mark, I'm going to hand it back to you one last time.
Nice. Thank you, Jeff. Great to see. Okay, so a couple last things. Jeff, this is more technical than
Sure.
I like to touch. So
No, that's all right. So we've kind of touched on a lot of these things. Well, Kurmi is the center of the UC ecosystem now. That you will inevitably, you are going to have, again, ITSM systems. You're going to have SBCs. You're going to have contact centers. You're going to have recording systems. You're going to have E911. And you'll need to actually be able to integrate with all those various different systems. But you don't want to have to log out and track things again. And did I already change it on this one, or did I miss updating this system? And how is it actually going to work? You may have multiple multiple phone systems you're also going to be working with as well. Kurmi sits in the middle. We talk to everybody, and we talk to everybody bi-directionally. So if you need to actually work in some of those hybrid and complex environments, and you need to actually make sure that's all going to work, we can absolutely do that. Few things are going to be coming in real shortly, as in June of 2025 or mid-year of 2025. We're going to have WebEx Contact Center. We'll be fully integrated with Genesys. We are already officially in the ServiceNow store as an application. That application is also fully customizable. We've recently also just released that we are able again to start working with audio codes as well as the Oracle SBCs, and there'll be additional ones added on throughout the year as well. But again, it makes it all from one screen. You can manage all of the various disparate systems you have across your UC platform, all from one platform. Thanks, Mark. You can go ahead and there we go.
Perfect. So a couple more slides, and we're getting towards the end. In terms of value proposition, I think some of this is going to be obvious at this point as we've moved through it, but I think the reduction in overall costs associated with these functions It's fairly dramatic. The time associated is correlates with that pretty well. We talked about reduction of errors, pretty significant. The idea that the SLAs that you can deliver to your organization as an IT team, you can increase time. The errors are going to drop dramatically, and you're empowering the right IT folks and help desk folks to do the right functions or the right sort of appropriate set of functions based on how you delegate those tasks out throughout the organization. So pretty dramatic. The ROIs are typically very compelling when you start doing the math on the time spent previously and what happens with Kurmi. So it's great to see. So we do have some questions, which is great. I appreciate that. We will get to those in just a moment. And so we'll start answering those. If it's technical, you can bet Jeff is going to cover it. If not, maybe I'll cover it. Yeah, we'll start looking at the questions now, and I'm just going to go to the last slide and just say, as we answer the questions, we would welcome an opportunity to provide you with a more in-depth demonstration. Obviously, we're happy to do a demonstration that reflects your environment, your requirements, the things you care about. So happy to do that. Just scan this code or come to our website. But we can provide a detailed demonstration and really talk about how Kurmi would fit into your situation. So with that, Jeff, I'm going to look at questions and see what we got. Okay, first one I see is, how many Kurmi admin profiles can be set up?
It's really up to you. There really isn't an upper limit, and especially if you look at our first case study, there was 2,400 locations. And you may have local IT teams that need to have that extra set up, but they can also be copied. There's really no limit to it, and it's really how you would like to have things customized and what works best for you and your organization, how you'd actually like to have things set up. Because Kurmi's done this before, we will give you some recommendations of what's going to work, what might work best for you. But at the same time, also you have full flexibility to actually be able to change things as well.
Perfect. Thank you, Jeff. Jeff, next one is this an online tool or software that we can download, install in our UC environment?
Oh, it could actually be deployed kind of both ways, actually. You could actually be privately hosted in Kurmi's cloud. It's deployed in the United States. And if you do want to actually be deployed in Kurmi's cloud, we're ISO 27001 compliant. All of our data is encrypted AES 256, both at rest and in transport. We also happen to operate worldwide, so therefore also we're GDPR compliant as well. So we do take security very, very seriously. But if you would actually still like to have that data sovereignty as well, we can also self-host this in your own environment instead. So we can absolutely go ahead and support both.
Great. And Jeff, as I look at these, they're all for you, which is fantastic.
Okay.
So how many templates can you have for users and shared devices?
Again, it's kind of unlimited. But at the same time, I will kind of give you a recommendation. A lot of your knowledge workers are likely going to wind up sharing, we would call it a package, profile, a template, however you'd like to refer to it. They're likely going to wind up sharing kind of that same profile, but you will have those specific use cases. Again, a nurse's station is going to be very specific. You may have an admin who actually supports an executive, need to have their phone number rolled over. So you will have those very specific use cases also that need to be set up. We can absolutely support that and make sure, but it's all going to be GUI based, and also going to be that we can help you actually to go through and set all of those for you and how it's actually going to be able to make you as efficient as possible.
Perfect. Actually, there is one that just came in for me. So does the ServiceNow integration you showed cost extra? No. So I think everything we showed is all a part of what we call the Kurmi provisioning suite. It's all included. There's no extras. And I think that you saw the automation and how we're integrated with the ServiceNow store. It's a very simple install to do, and it's all part of the suite that you get with the licensing. There's a few more questions, but we can answer those offline. They're kind of derivative of previous questions to some degree, so I'll take those offline if that's okay. Jeff, any last thoughts, or want to wrap it up?
Yeah, no, really, it's just again, Kurmi's kind of the center of the UC universe. It's gotten messy, so let's we can absolutely help to clean things up and make an engineer and a technician's life a heck of a lot easier.
Wonderful. Thank you for joining us. Again, if you have questions, let us know. If you want to see a demonstration, happy to do it, and appreciate your time today. Thanks, everyone.